Okay, yeah. So the idea for detox and drainage is that there's common misconceptions of like detox is this one event that you do, drainage is another event, but we want to connect the dots and how these are daily things that our bodies are doing, and we need to help our body out because of our toxic environment. Let's go. So I'll walk you through the drainage funnel tonight, like reasons why detoxes fail, and that's where they get a bad rep is because a lot of times the drainage funnel isn't followed properly. Most people jump right into just killing everything, and then the body gets overwhelmed, and then they have like Herxheimer or die-off reactions. And then we'll give you some ideas on how to detox safely and correctly. So detox is how your body removes toxins. That's what the liver is like a garbage dump. It's going to be gathering, filtering, and then pushing out, detoxing toxins. That could be heavy metals. That could be chemicals. It can be die-off like ammonia from pathogens. Those are some common things. There's like we talked about last week, when you sleep, there's this brain lymphatic system called the glymphatic system, and that's removing toxins from your brain and pushing them down into the remaining funnels, your liver, kidneys, and on out. But that's detoxing. Drainage is how those toxins go from like the brain into the colon and out through your bowel movement. So drainage is your the pathways that you detox through. And that would be kidneys and liver and colon, lymphatics, and there's your bile. But that's how ideally drainage is working perfectly. So you can go about your day eating your whole foods and drinking your good water, and your body's doing the detox for you. But a lot of times, I'll show you a picture in a little bit. We're in this bathtub, bath water that's a toxic dump, and the clog is, or the drain is clogged. So the detox and drainage pathways are stuck. So then then it backs up into symptoms and disease that we experience. So this is a kind of like a debate in the holistic community on like media. There's some docs, and we follow and we've learned from both sides. Some docs say you should just take and get rid of the pathogens, and that will handle your drainage. And then the other side is saying you need to give yourself energy, regulate your cells, open the drainage pathways, and then go after the pathogens. And what's cool in practice is we've definitely experienced both ways and have had success both ways, but the most consistent and I feel like the best results have come from when somebody comes in and they never done any detox, but they know there's something wrong. We test them, there's parasites or toxicity showing up, but we know that if we were to put them on a protocol, they would have those die-off symptoms and their body just isn't ready. So then we do like a month of we call it a jumpstart month, and then we work on drainage and then get into the pathogen removal. And they have some amazing results. And so the other way we've had a lot that have die-off results. So they both work. We just find that why not focus on drainage? Why not focus on the progression of it? Because healing takes time anyways. We're something that's been built up for months and sometimes years isn't always going to leave readily and happily over a couple weeks. So drainage, working on your drainage pathways, prepares your body for a safe and effective detox. And this will prevent the Herxheimer reaction. Like extreme fatigue, detox fatigue, skin reactions, rashes that can come up when you're killing things off or trying to detox things. Extreme brain fog is a big one, and diarrhea, constipation. Those are other things that happen when your drainage pathways aren't ready. So this is a cool illustration of what I was just talking about. So the one on the left, the you'll see it's not overflowing. It's like a thin, it's like the water is running right through it. It's going how it should. That's the healthy body system, body drainage funnel. And then the one on the right is showing an unhealthy drainage funnel. So this is where it starts with the colon, the drainage, the thing we should be doing every day, maybe a few times a day. So ideally, you're having one solid bowel movement every day. The healthy range is probably more 2 to 3 times a day, but that's the one of the essentials of health is that has to be working for you. If that's not, then that's the first place you have to start. Because one, if you aren't having bowel movements and then you go and try to do a detox, that whatever you kill off, the die off, and that is going to recirculate into your system. It's going to go into your blood, and then that shows up in your skin. It will show up. It will bring your kidney energy way down, and then your lungs will be affected, and on up. So that's why that's so important. The others. So if you start down there and then you work up, get your liver and bile moving good, that's when you start to really get things cranking and your body starts to be able to breathe and do its job. Another cool thing about this overflow here is that women's menstrual cycles fit into that as well. Your blood fits into that too. But that's so cool about how your cycle is a monthly report card, and it says so much about your health. So that's just another overflow duct. That's a drainage pathway that needs to be perfected for your body to function how it desires. Does anybody have any questions so far or comments? Okay. So starting at the bottom of that funnel is the colon. So it's the base, it's the foundation where everything's built on top of. So there's some common reasons for that to be blocked would be parasite infection, bacteria, and like SIBO, stress shuts everything down. That brings your immune system down with it. Poor bile flow, mold would be in this as well. All of that above will bring your stomach acid down. And when your stomach acid isn't working, that's when your bile flow will slow down. That's when you can't break down your foods. And then that's going to bring along more parasites and bacteria because they're here to break those things down for us. But it becomes not so beneficial for us anymore. And then the other big one is environmental toxins, which is in our, like we can get it through our air. It's in the rain heavily. It's especially heavy in our water. So those are just some passive ways that we get it. And then there's other modalities like medications, vaccines, and yeah, those type of things that we can get them from too. So that's what we want to focus on that first. And it's 1 to 3 bowel movements a day. There's a lot of things that can help with that. Aloe vera juice, apple cider vinegar. A big thing is just keeping hydrated. Dehydration, lack of minerals throws all that off. So that's a really basic thing. And then, like we talked about in the first week, and then the second week, we talked about how to move for detox. So that movement, physical activity is so helpful for this part too.
Jordan.
Yes.
Yeah, I thought you also gave a little spot for me to say something, but I think it's interesting that the gallbladder produces bile. Well, the liver produces, the gallbladder distributes it, but that bile lubricates our colon. So when you get into things of like constipation and then further down the road, diverticulitis, colitis is oftentimes that comes back to the bile is not being produced and not being there to lubricate and move the stuff through the colon. And then I also want to suggest, you mentioned about pH, which is really important, but this nervous system is really important. And one of the big things that we always check this is the vagus nerve, especially, but that creates peristalsis. And vagal tone is one of those things that, like healthy channels of movement are controlled oftentimes by the parasympathetic nervous system. So, I mean, I know we probably covered this too, but of course, your breathing exercises, and of course, how that moves in your body and waist. But your gargling and your singing and your laughing, all those things will exercise the vagus nerve. So that tone. And then the other thing I want to say is that when you look, and it shows up on your chart, but you start either with cells, and that's kind of micro. I mean, you have the cells have to detoxify, and then you have the big things. And I use the acronym like SKILL: skin, the kidneys, the intestines, liver, lungs. Those are all detoxifying. So like when you think about skin, of course, when you sweat and when you dry brush, all that kind of stuff. But the cells have to detoxify, and that's a different thing. And so what Dr. Jordan was saying about whether you start with the cellular level or at a bigger picture, like just making sure you're having a good bowel movement. Those are all important. The one thing about cells, though, is that's where a lot of our energy starts. And so, in order for you to heal, certainly you got to have good nerve tone. You don't heal when you're in fight or flight, but you also have to have energy to heal. And so that's one thing. So that might be an area where you might start with everything we've talked about, like movement, breathing, sleeping. All those things are so vital, and get those things in. But those can create energy to start moving and healing. And then on the other extreme is like, okay, our organ flush is like, can we just do some things like get into our abdomen, start working the liver, the kidneys, start moving things around, do trigger points and things that we oftentimes talk to people about. But it's really important to have things moving. And if they're not, and we see people that they might have a bowel movement a week, and that's, and they know that that's not right, but their medical doctors will sometimes say, well, that's not unusual. And it may not be in their world, but it sure is unusual in our world. We know that if that's not working, that creates a lot of problems. So, whatever you have to do to get that going, and everything, like Dr. Jordan said, that preceded this meeting tonight lines up right with that. Your movement, your sleep, your nervous tone, your breathing, your circadian rhythms. I mean, most of you probably know you use the restroom on a frequency. There's a time when that happens. And so we're just kind of like into these normal circadian rhythms in our life. And so anyway, I want the micro part of us, the cellular level, like you showed on your funnels, and then the macro. Okay, Jordan, just thought I'd interject that.
Thank you. Yeah, that's fun. As far as the Jasmine's question of how to shift your pH, okay, thank you, Andrea. I just saw your response. So yeah, there's a lot of ideas for that, and even dietary things that add in to help shift your pH. But that's also where like the thought of toxicity causes deficiency. So like if you do have chronic low stomach acid, what is the toxicity? And is that a chemical toxicity, or is that an emotional toxicity, or is there something not physically working like a valve or your liver? So you have to help. So just some things to run through your mind. The next layer up would be your liver and bile. So that's the processing plant, the garbage dump. The old timers say you have to speak aggressive to the liver because it does a lot and it's a hard working organ. You also have to speak kindly to your heart. So just interesting emotions in our body. But there's 3 layers of detox in our liver. It's like phase 1, phase 2, and phase 3. Phase 3 is the elimination, is the bowel movement. That's where everything that phase 1 and phase 2 pushes things into. So phase 1 is, well, actually, I won't go through the specifics on the phases, but the reasons why the liver phases would be blocked down, would be because of these possible causes to the side here. And like anger, resentment, depression, galled being like galled emotions, those are all things that affect your liver and gallbladder emotionally. So that's a big one. Obviously, the poor diet, there's so many seed oils and processed foods that just keep backing up your liver's having to break down all these extra chemicals in the foods that it can't actually handle the nutrients and also possible other junk that it's bringing in.
During two other things the liver ties to as far as emotion and stress would be holding feelings back. So like that's another like repression organ if you hold things in. And then depression. Those
Okay.
are two other interesting ones that go beyond like that anger.
Okay. Is the what do they say about the liver? Like, is that like the main or the organ that holds all kind of thing? Emotions or
I know that about the bladder,
oh, okay.
holds the unresolved emotions, but the liver has to process a lot of those things. So if it's not being processed through, it starts getting stagnant in the liver.
Ah, okay.
Yeah.
Yeah. So there's that, and that's a really good like correlation of how kind of the metaphysical affects the physical. And same with lack of movement. Like if you are not on purpose, if you're stagnant in life, in your mindset, in a relationship or in your faith, like that's going to show up physically somewhere down the line if you don't resolve that and work through that. So that's just it's really cool to see how our spirit works with our body.
Like Andrew said, stuck emotions are stuck energy, and stuck energy is stuck emotions. So you get it moving, and it helps everything else. And you're right. I mean, the liver holds a lot of stuff, but what you're referring to, the bladder holds a lot of emotion and affects our brain a lot. But
Mm.
liver, you'll oftentimes see feet problems go along with liver, and certainly a lot of joint pain, arthritis will go with a liver that's not working. And your liver makes things that are anti-stiffness factors, and we use some things like beta col sometimes to have those factors released in the body, and it helps the joints to not be stiff. And
Cool. I didn't know that about the feet. The thyroid will get blamed for a lot of issues that are actually happening in the liver. It's a lot of hormone imbalances, toxic estrogen not being able to be flushed out will cause a lot of symptoms that I feel like a lot of people get put on birth control or well, synthetic hormones because their liver isn't processing what the body's naturally trying to work out. Gallstones, which those are parasite related. So like the basics are got to get that bile moving. And that's where like physical movement, that's where castor oil topically can help with. Same thing with getting your strengthening your stomach acid. So the apple cider vinegar. There's like for all of this, there are products and there's supplements, but we're just talking about like the basics and trying to jumpstart things. So the organ flush, which I can try to show you in a little bit, but organ flush is a huge tool to just it helps break loose debris from like physical debris or stuck energy, stuck emotions while you're working the organs and then your body's better able to get them out.
You mentioned castor oil too, right?
Yeah, topical castor oil, which
Yeah,
is
topically. That's a
oh,
great
and
one.
I mean I didn't put on here, but coffee enemas are like gold for this movement
Hmm.
as well.
was
For
it about 500% increase in glutathione, the big antioxidant, through a coffee enema?
yeah,
Yeah.
yeah, there's a lot that can help with plus clearing out the pathways.
I was thinking there's a term called gastroparesis. I know some kids that have had that where they were talking about taking part of their colon out, and an adjustment opened those pathways to that gastroparesis is where the nerves weren't allowing the colon to move, and adjustment helped to move the colon. And during the pandemic with the virus that was out, that affected the nervous system, and so people come in with gastroparesis. That means that their colon was not moving, their stomach wasn't moving, and when you adjust and reset that, a lot of those would just clear up. And but that's just how important your nervous system is to be adjusted sometimes, to have it reset. And we talked about the vagus earlier, but even your spinal, your other sympathetic nerves are important to get movement to move things around. Peristalsis, the movement of food through that tract.
Yeah. Well, and that's the thing of like chronic stress. If you're on the gas pedal all the time in fight or flight, your body is not worried about digesting food. So it's going to forget about that stomach acid and it's going to be pushing the circulate blood and energy to the organs that are needed to fight or fight. So that's why that like breath work and prayer, meditation and walking, all the basic things are so important to regulate that balance of staying in the parasympathetic and then coming up to the sympathetic when you need it, and then being able to drop back down because that's where community happens. That's where rest, sex, digestion, all that happens in parasympathetic. So we have to really focus on having a good balance there. Yeah, and since I talked about coffee enemas, that is like good for the whole drainage funnel. It unlocks so much for you. Um, so the lymphatic system, that's the drainage pipes. That's where your body pushes the junk throughout the whole body, and then that work makes its way down to the liver and on out. So like cellular waste, like what Dad was saying, and it's kind of crazy how there's one supplement in particular where we put people on. It's called BCATP. It's pretty much just high energy carbon, but it detoxes you at a cellular level. We actually have done that with some homeopathics too. But people have some detox reactions from what they're pushing out from their cells, and that's stuff that's been probably harbored for years. And it's just been kind of wild to see how deeply toxic we can be and how little it takes to work some of that out. So, one cool thing and something that you can really look at if you've had some chronic issues is scars. Look around your body, see if there's any known scars that you have that that like C-sections are common or surgery scars, but scars can really disrupt your nervous system, your meridians, because all of that runs around your body in infinite circles. But a scar is like just if you have a scar on your arm that's near the gallbladder meridian, that can affect your gallbladder and that can cause digestive issues and maybe it leads to you having to take your gallbladder out, unfortunately. But like if you didn't know all that connection, then that's probably the route you'd have to take. But for scars, you can resolve those pretty easily with high vitamin E oil like castor oil or wheat germ oil, and then you put red light in combination with that. And there's been people where scars just fall off after I forget how long it was. It was a month or so for sure, but
When scars can be from tattoos, they create a lot of
oh,
scarring in the body, so as well as like the ink going in. But any tattoos, like, should always work that through. And then there's internal scarring too. So from surgeries or like endometriosis, those can create internal scar tissues. After birth, you have an internal scar from where the placenta was too. So
hmm.
there's a lot of things, even if it was a VBAC, there's a lot of areas that you still have to think about, like where could that be more of that stuck, stagnant energy? Where would that be holding it?
Yeah, that's a really good point. Yeah, and that tattoo thing, we were at a seminar the other, you're talking about just like breast implants and tattoos and stuff that have just been accepted. But there's a patient of theirs that they had a lot of tattoos, and it actually turned their lymph vessels and the color of their lymph in that area black, like the color of that tattoo. So it's not just surface level stuff that's seeping through and getting into your bloodstream and really affecting some major areas. So obviously, lymph needs movement. So sedentary lifestyle would sit you back. Dry brushing is really cool. We like organ flushing because 80% of your lymph goes through your liver and your colon. So if you're massaging your liver, you're getting a majority of what's stagnant. But sometimes dry brushing is needed, and that's where you can use a really dry kind of rough washcloth or a dry brush, but you take it from your hands, like from your fingers, all the way up to your heart, and then you go from your toes all the way up into your heart and work all the way around. But you can look up on YouTube for tutorials, but that's been pretty cool for what such a light stimulation can release in your body. Oh, I shouldn't
I
add
have something in there. Yeah.
vibration plate and
Rebounding.
rebounding are really helpful for that as well. So mitochondria, that's at the top of the drainage funnel. That's your cells. That's your powerhouse, the power plant where you get your energy from. There's 95% of our melatonin actually comes from mitochondria, and 5% comes from the pineal gland. But mitochondria are they build all of our organs. Our brain, our testicles, ovaries, heart, they're high mitochondrial areas. So some things that can disrupt that are like diabetes, or if you're insulin resistant, EMFs are a definite disruptor for that. Glyphosate, heavy metals, the list goes on with toxins in the environment. And then nutrient deficiencies are definitely prominent now. And it's one thing that like we can take all the supplements in that we could possibly take in a day. Like Dave Asprey takes, it's like 100 or so in a day. It's just insane. He thinks he'll live into his close to 200 or so, but like that is, I just think it's overkill to the max. But we are nutrient deficient because our food isn't grown in nutrient dense soil anymore, and the harvesting is timeline and all that's thrown off. So we do need to make sure that we are using every nutrient that we're putting in. So that means creating the environment inside our body to break down the food, and then for that food to be put where it needs to be. So that goes back to the liver and our stomach and how we break down things.
I want to just say, and this goes back to Jasmine's question about the pH, but one of the most frequent things we see, if anybody's got digestive issues, the doctor will put you on a proton pump inhibitor. And I just so much dread that, because people may decrease acid, but see, that's so important for your digestion is to have a pH. And the parietal cells that need to make the hydrochloric acid require iodine and zinc, hydrochloric, B, coenzyme Q, carbon dioxide. But the proton pump inhibitors will inhibit your B, your iron, magnesium, iodine, selenium, chromium. And so it gets also that's very much creates a nutrient deficiency. And when you have that, it increases like your insulin resistance. It decreases cell signaling. So you have about a 40% higher chance of heart attack on a PPI, stroke, a 40% increase in dementia with that. So those things probably should never be used, but I mean, probably very infrequent, and they're supposed to be short term, but some people are on them for a long time, and they're hard to get off once you because your body has to get back and take that over. So like Jordan was saying, we are oftentimes drugging deficiency. That's what Roy Lee used to say, the founder of Standard Process. He says we're in a day, and this is back in the 30s, where he said we're drugging deficiency. We're not figuring out what's going on in our body. We're just throwing drugs at it. So you got to have proper channels of detox, but you have to be breaking your food down, and that starts with a good pH, which also helps your immune system because it knocks out so much of your the pathogens that might flow through that area. All right.
Thank you. I just pointed to the basics of mitochondria, and it's so simple. It definitely gets overcomplicated, but like get out in the sun, have a good circadian rhythm, get good rest, walk, water, minerals, just really basics, but those get overlooked so often. And we dive right into like the intense detoxes. So I just really want to hammer how important food, water, air, light, like movement, like there's so many beautiful basics that we've been gifted with that to use food as our medicine and so forth. But let's get moving here. The next one, or the other one actually below that, the cells would be brain and organs. So like I talked about, the brain grabs the junk that's in the lymphatic system and then pumps it down. But the crazy thing is, like with aluminum and mercury, especially in vaccines, those drive the other factors that are in the other ingredients that are in vaccines. Those heavy metals are used to push those to deeper parts of your tissue. And there's been glyphosate found in vaccines as well. Glyphosate will take aluminum and then that will drive aluminum deeper into your cells. So the thing is with all that being injected into your blood, there's been studies that show all of that goes right to your brain. And then your brain's really fatty tissue. And so you can go a while maybe without noticing any different symptoms, but my goodness, there's a lot of little kiddos that get vaccines and they'll never be the same because of what's in that and what just there's a travesty with it going on with all that. Here's a fun analogy, and it's pointing to the drainage funnel. It's a fun way to think about it. So we are the fish. Step one is what's coming into our environment. Like, so we're a fish swimming in the clean bath water until a situation comes up, or until literally it rains nowadays. There's enough chemicals in that to set you back, and then we eat some bad meals and take some drugs or drink some alcohol or have a chronic time of stress, whatever our toxic sludge is. And all of a sudden our bath tank needs to be emptied, but we have to be able to unclog the drain for all that to flush down. So that step 3 is our elimination pathways, like the colon. So that's why we get in so much trouble, is because like we're living in this toxic environment, which is fine. Like we can adapt to that. We're made to live in this time. Like that's why we're put here where we're at right now. But we will make it a lot more difficult on ourselves if we aren't handling the basics, like keeping the drain unclogged so our body can detox, can flush the dirty water out when it needs to. So that's why you don't need a better detox. You just need to work on drainage.
I love the fish analogy because, I mean, you got a dirty fish bowl. Are you going to be working on the fish, or are you going to start working on the environment around that fish?
Yeah, epigenetics. That's it.
I mean, all these things that trigger our sickness, but they're all in, all right, clean up your food, clean up your air, clean up your water, clean up your thinking.
That's good. And this is just another, like I've talked about all the chemicals and all that, but it's really like we start off life, ideally we start off life with a very empty bucket of these toxic burden stuff, but that's not the case anymore. But we got to be able to clean that up. But as that over life, as those things pile up without getting resolved, then your symptoms start to increase and you start to not know who you were a year ago, because now you have all these new symptoms and you went from one disease to the next and one medication to the next, and it's just on and on. But this is kind of another visual of toxic overload.
Dr. Jordan, I know you probably know this answer, but how many chemicals are in the umbilicus of a newborn between the mother? I mean, they're about 100, I'm thinking. I mean, I've heard the number before, but think of a child starting off with that kind of thing, and that's probably not even including fetal alcohol or cocaine, and that some mothers bring their baby into that environment too. But yeah, our environment is full of it, and unfortunately, our children are getting that early on.
Yeah. Yeah, and that's a whole other talk where we talk about how the father passes down a majority of that, and the mom passes down your mitochondrial health and your biome, but the father passes down anything that's not resolved. So like diabetes, insulin resistance is one, addictions, and then just any other unhealthy traits too. It can be passed on. This is just kind of a nice summary of like the practical things we talked about throughout. But yeah, I mean, if you look on that list and maybe pick one that you feel like resonates with that drainage issue that you've had. Like these, a lot of these just help everything, which is nice. Red light therapy, castor oil are really simple, and you can put those directly on the area of effect, or just go throughout the body where it needs it.
Jordan, why don't you share why you would use distilled water?
Yeah, well, that we talked about in that week one, but that's like, so you can well, let's take well water for example, because a lot of people think that because it's well water, it's it doesn't have the chemicals that city water has. But well water isn't regulated. And when people run tests, there's arsenic levels, glyphosate levels, there's
Radiation.
yeah, radiation is big, especially in the Midwest. But those levels are incredibly high. So then maybe you get like a reverse osmosis, and that's better. But like that said, radiation is prominent in the Midwest, Wisconsin, Indiana, Ohio, Iowa. And the only way to get rid of that is to distill your water. And distilling is like it's leaving behind everything that's not water and just keeping the water. So that's why it will be the same the first time you do it and the 1,000th time you do it, that you'll get the same result with that water. With reverse osmosis, it's good for a time, but then your system starts to you have to replace the filters a lot, but then like your main filter and that can get worn down pretty quick. And so it's just not like consistent over time. That's actually been something where if you're having a hang up in your health, and there's been people that switch to distilled water, they actually will have detox reactions because of what their body can then take care of and is not having to work through. And that's another thing. We use distilled water in our coffee enemas, but coffee enemas work on everything from the colon to the kidneys, your lymphatic, your liver. It's an emotional experience. It's a kind of, it can be dirty, but you get the flow down, and it's just it's therapy. That's where I've gotten it to be. And I can even do it with three little ones. Two of them climb on top of me when I do it, but we make it happen, and you feel a lot better afterward. But a lot of good tools. So that is the end of the drainage and detox talk. This is starting next week. We're excited to kick this off. This is like a sneak peek to our bigger program, our 3-month program. But this is just 4 weeks. It's $500. Ideally it's a group that is ready to really get an overhaul in their health in a short time. Our first month of the program is jam-packed like with recipes and what to eat for this month, really structured out well, how to clean up your kitchen, get you ready to succeed, there's modules on mindset, habits, movement. So that's what we're just excited to offer. And we're actually giving away 2 registrations too for people who sign up, and then we'll do a drawing for that. But this will be fun, and we'll keep running this because healing happens best in a group. And again, this is like you've learned some of the basics, and this you'd be practicing the basics.